Right now, as you sit watching this, something completely silent could be happening inside your body. No pain, no warning, no signal that anything is wrong. And yet, this hidden process is quietly increasing the risk of stroke, heart damage, and long-term vascular decline in people over 50. Here's the part most people never expect. It's happening in those who are trying to stay healthy. People who take their vitamins every morning. People who follow their doctor's advice. People who believe they are doing everything right. Because one of the most trusted supplements, vitamin B12, when combined with just 2 very common medications, can create a chain reaction inside your body that almost no one explains clearly. If you take B12, even occasionally, you need to understand this before your next dose. As a cardiologist who has worked with adults over 50 for decades, there is a pattern that appears again and again. Patients who are disciplined, careful, health-conscious, and yet they experience sudden fatigue, mini-strokes, or unexpected cardiac events that seem to come out of nowhere. When you look deeper, you begin to see the same combination. Vitamin B12, paired with one of 2 medications that millions of people take every single day. In the next few minutes, you'll understand exactly what those medications are, what's happening inside your body, and what you can do, starting today, to protect yourself. Before we continue, comment your age below, because this message becomes more important with every passing year. There's a compound in your blood called homocysteine. Most people have never heard of it. Most doctors don't routinely test it, but it plays a critical role in your cardiovascular health. When your body is balanced, vitamin B12, along with B6 and folate, helps break it down and keep it at safe levels. But when that system is disrupted, homocysteine begins to build up. And when it builds up, it starts damaging your arteries from the inside. Slowly, silently, over time. Imagine your arteries as smooth, flexible tubes. Now imagine tiny, invisible scratches forming inside them, day after day. That's what elevated homocysteine does. It creates inflammation, reduces flexibility, and makes it easier for plaque to form and become unstable. And this is where the real danger begins. If you have type 2 diabetes, there's a high chance you're taking Metformin. It's effective. It's widely prescribed. And for blood sugar control, it works. But over time, Metformin interferes with something essential for B12 absorption. A system in your gut that acts like a transport mechanism, often called intrinsic factor. Without this system working properly, B12 cannot be efficiently delivered to where your body actually needs it. So what happens? Blood tests may show normal or even high B12 levels. But inside your cells, your body is still struggling to use it. And when B12 isn't functioning properly, homocysteine begins to rise. A 71-year-old woman once came in with a simple complaint. Not pain, not illness, just a deep, persistent fatigue that didn't improve with rest. She exercised regularly, ate well, and had been taking B12 supplements for years. Her blood work looked normal. But when a deeper test was done, her homocysteine levels were dangerously elevated. What looked healthy on paper was quietly stressing her vascular system underneath. Now let's talk about the second group of medications. Acid reflux drugs, commonly known as proton pump inhibitors. These are extremely common after 50. They reduce stomach acid to relieve heartburn and protect the stomach. But here's what most people are never told. Your body needs stomach acid to release B12 from food. When acid is suppressed for long periods, natural B12 absorption drops significantly. So supplementation is often recommended. But in some individuals, this creates an unstable cycle. Absorption becomes inconsistent. Processing becomes inefficient. And once again, homocysteine begins to rise. A man in his late 60s had been taking acid reflux medication for over a decade. He also supplemented with B12 regularly. He felt mostly fine, just occasional off days. Then one morning, he experienced a stroke. No major warning signs beforehand. But when his case was examined more closely, it revealed years of silent imbalance building beneath the surface. Here's the problem. Homocysteine is rarely included in standard blood tests. So even when everything appears normal, a key risk factor may be completely missed. That's why so many events feel sudden. In reality, they've been developing quietly for years. This is where things change. Because this is not about fear. This is about awareness and control. Here's what you can do starting today. First, if you take metformin or acid reflux medication, ask your doctor to check your homocysteine levels. Second, understand that not all B12 is the same. Some forms require multiple steps before your body can use them. Others are already in an active form, making them easier for your body to process. Third, avoid assuming that higher doses are always better. Balance matters more than quantity. And finally, review your medications and supplements together, not separately, because your body doesn't treat them separately. A woman in her 70s decided to check her levels, not because she felt unwell, but because she wanted clarity. Her homocysteine came back more than double the safe range. Simple adjustments were made. Within a few months, her levels improved significantly. And more importantly, she felt a level of energy she hadn't realized she had lost. Here's the truth. Vitamin B12 is not the problem. In fact, it's essential. But when combined with certain medications, and without the right balance, even helpful things can create unintended effects. The key is not avoiding B12. The key is using it wisely. And now, you have the awareness to do that. If this gave you a new perspective, take a moment to like this video. It helps more people over 50 discover information that could genuinely protect their health. Comment protected if you're going to review your supplements starting today. And share this with someone you care about, because they may be taking this combination without even realizing it. Subscribe for more clear, science-based health insights designed specifically for adults over 50. Because here, we don't just add years to life. We protect the quality of those years.